Welcome all to the first of our Arise blogs, which deal with disability and COVID-19. This is a first blog in a series, which you can find on our website. And in this blog, we tackle risks and vulnerability related to disability and COVID-19. We heard from members of the public and also expert tweeters on our chat that there is a difference between vulnerability to infection, vulnerability to severe symptoms, vulnerability because of lack of access to service or deprioritization, and vulnerability to the social, political, and economic effects of the pandemic. So, also disability may intersect with other axes of oppression. For example, women with disabilities may be at different kinds of risk to men. Younger people might experience different risks to older people, but all layers of vulnerability and risk are important. We heard that people in refugee or internally displaced people's camps, institutional care, and other settings where people live closely together or where they have less agency are vulnerable to infection. Some forms of disability themselves increase vulnerability to infection, particularly for those people who have disabilities that affect their lungs or their immune system. Some disabilities could exacerbate symptoms of COVID-19. Older people are more vulnerable to severe symptoms, as are people with chronic illnesses such as heart disease or diabetes. So as the IDA say in their tweet, some people with disabilities are at higher risk of contracting COVID-19 due to underlying impairments. But we are receiving information on discriminatory treatment of people with disabilities when accessing emergency services. Their lives are not less of a priority. It's also true that our understanding of physical vulnerability to COVID-19 is changing every day as we find out more about the virus. As Janet Price said in a tweet, questions of who is at risk change all the time. The viral load seems to have a big impact, and we also see younger people dying, for example, nurses and doctors, when not fully protected. Thus, those with weak immune systems, respiratory symptoms, are at very high risk with a high viral load. Certain types of disability, for example, intellectual disability, being blind or being deaf, may mean that you have less access to health promotion information and other forms of advice, increasing vulnerability to risk of infection when you're unsure or you're unaware of the need or ability to adapt your behaviour. As IDA CRPD Forum pointed out, blind persons need to sometimes touch surfaces to navigate. Deaf-blind persons rely on touch and hand language to communicate. Nigeri Maria said, having a different ability does not by itself put them in higher risk of infection, but they are in danger due to discrimination and barriers to information, social services, healthcare, social inclusion, and education. Now, we've seen rates of intimate partner violence increase in those countries most affected by the COVID-19 pandemic. And participants pointed out that people with disabilities might be vulnerable in this regard. For example, women with disabilities are often at greater risk of gender-based violence, which is exacerbated in times of crisis. The IDDC said, in a survey done by our partnership, preliminary outcomes show an increase in gender-based violence and increased burden of care work on women and girls, which are disruptors of education. Girls with disabilities are already at greater risk of gender-based violence and unpaid care work. They also explained that disabled children are routinely deprioritised in terms of education and often drop out of school, and there's a risk the pandemic may exacerbate this situation. Participants expressed fears that regularised relief that people with disabilities routinely receive from the government might be obstructed or hampered by the pandemic. They felt that in general, people with disabilities are thought of last after others' needs have been met, and this makes them more vulnerable. Some disabled people will have to rely on charitable handouts for survival as a result, which was considered undignified and a denial of their rights. In low and middle income settings, disabled people may be employed in the informal sector, for example, deaf parking attendants in Uzbekistan, and thus find it more difficult to adhere to lockdown directives because they can't work from home. This is particularly true in contexts where social protection is limited. In some settings, disabled people may try to make up economic shortfalls through work in the sex industry, placing them at higher risk of violence and sexually transmitted infections. Children with disabilities may be at higher risk of family separation. Joseph Etienne says the challenges that people with disabilities are facing during this curfew, the small businesses they were doing to earn a living currently get little to zero yields. Considering these are the people who mostly earn money by hawking in the streets, even that's now not the case. He's talking about Kenya. Samuel Saidu from Sierra Leone said, a practical question from my side would be, how will people with disabilities, with no education, who beg from the street daily, have no budget from mainstream government and live in an impoverished urban informal settlements, take part in the COVID-19 issue? There are mental health considerations that relate to fear of the pandemic and also fear of the response to the pandemic, which threaten the rights, the health, and the lives of people with disabilities. Jennifer Johnson said, when people I know blatantly disregard civil rights for people with disabilities and then defend their position, it puts a damper on my day. How do you deal with that feeling? How is it so hard for people to treat other people like humans? Those people who've been institutionalised because of mental ill health are vulnerable in ways that all incarcerated people are. They have little opportunity to protect or isolate themselves, and they're subject to institutional rules that they have little power over. Shikuku Obosi said, people with psychosocial disabilities are more vulnerable because of being placed and or deprived of their liberty in psychiatric units and institutions. There was also a concern that disabled people who contract COVID-19 may be subject to a double burden of stigma that would have psychosocial effects. Taking a holistic approach to health and well-being is critically important, particularly for those with multiple vulnerabilities. Ensuring all services are adapted for inclusion is essential. Thank you for listening to this blog. I hope you'll tune in to the second in this series. But this is Kate Hawkins for the Arise Consortium.